The doctor is in. I'm Dr. Freddy Gomez, and this is Med Talk, Health Talk. Technology and innovation are fast evolving, and they're changing the way we live and do things. Our daily activities are incomplete without the help of technology like gadgets, and we can also use them to monitor and improve our health. Access to primary health care remains poor in rural and remote communities. And while PhilHealth covers 93% of the population, Filipinos on an average still spend more than 6,000 pesos on their health needs. The good news is technology is starting to bridge these gaps, and available now in the Philippines is telemedicine. Digital clinics are also starting to operate. But how reliable is this kind of health system? And can the majority of Filipinos have access to them? And to talk more about this topic, we have on the program Dr. Raymond Francis Sarmiento. He's the director of UP Manila's National Telehealth Center. And joining us as well is Dr. Eric Tayag of the Department of Health's Knowledge Management and Information Technology Service. Welcome to the program, doctors. Now, telemedicine, definitely a very new and hot topic, although it's been around for a number of years. Dr. Sarmiento, what exactly is the concept of telemedicine?
Telemedicine is defined by the American Telemedicine Association. That was in 2012 as the practice of medicine that's augmented by the use of information and communications technology.
Okay. Now, is it still fairly new here in the Philippines?
In the Philippines, the National Telehealth Center has been spearheading telemedicine efforts since 2007. It was initially funded through the Bodyworks project, wherein our center procured a number of computers and other equipment that was deployed to the remote and rural communities for us to be able to help out the rural health units and the communities with their medical concerns.
Now, Dr. Tayag, what is the outlook of the Department of Health with this fairly new type of technology?
Telemedicine for us is providing online healthcare services when the distance between the provider and patient is a concern. For us, when vendors visit the Department of Health and they sell us ideas or actual applications and tools on telemedicine or telehealth, the first question is this going to benefit the poor? That's very important for the Department of Health. Because if the application will not include the poor, then that's a red flag for us, because everybody should benefit. And that's why we're pushing for the passage of a law. Okay. So it's now called the e-health bill in both houses. So this will clarify questions like, what about fraud? What about patient confidentiality? About the security of information? How about the quality of these telehealth or telemedicine services?
How exactly does this telemedicine work? Does the patient still need to see an actual doctor physically after they've seen them virtually?
So normally at the National Telehealth Center, we engage with the general medical practitioners, municipal health officers, city health officers, provincial health officers, for them to be able to be connected to the nearest, if possible, clinical specialist. Within 24 to 48 hours, the response from the clinical specialist will be transmitted to the referring doctor. So because of the inherent nature of the system that we currently have right now, which could be via call, SMS, MMS, or email, we are only catering to non-urgent and non-emergent cases, although we have been moving forward in terms of our efforts to be able to provide real-time live teleconsultations.
Now, will telemedicine be covered by the Universal Healthcare Law?
It is in the Universal Healthcare. In fact, when we implement Universal Healthcare, after the implementing rules and regulations is signed this year, we're going to establish pilot areas for telemedicine, including RxBax, which is a store and forward variant of the telemedicine or telehealth services that will be available soon. So Filipinos have to watch out for this, because this is going to be beneficial, something new, something revolutionary, and we want to make sure that everything is in order.
Okay, so you got our excitement up with the RX box. I guess, Dr. Sarmiento, what exactly is the RX box?
So the RX box has been around since the initial prototype was in 2008, I believe. It's a biomedical device and a mobile telemedicine device in that sense that allows you, the user, to be able to collect and store all biomedical signals. That would mean if you wanted to measure your blood pressure, your blood oxygenation level, if you are caring for a pregnant mother, it also has attachments for the device for fetal heart tone monitoring and also for the tachometer for the contractions of the pregnant mother. There are also provisions for an ECG. So a lot of these attachments for the device allows the clinician to be able to have a better view, a more holistic view of the case that is presented before him or her. And then if there's any need or urgency for that particular patient, let's say the patient is due for a cesarean section and will need to be transferred or referred to the nearest able medical facility, then that will be able to store all of that information and be transferred to the receiving facility for better care and for ensuring patient safety for the patient.
So with that, do you have a final word or a message for our viewers? Let's start first with Dr. Sarmiento.
So I just wanted to tell our audience that telemedicine is here. It has been here for several years and it's here to stay. It is considered one of the state-of-the-art systems for increasing access for medical care and for also ensuring patient safety. So if you will be located in a particularly challenging or remote area, then availing of telemedicine options will be the best options for you moving forward.
Okay. And Dr. Tayag?
Well, for smokers out there who want to quit, try this. If you have messenger accounts, go to mHealthPH and see the results in a few weeks.
Okay.
And good luck to you.
Okay, thank you very much for joining us, Dr. Sarmiento.
Thank you, Dr. Gomez.
And when we return, let's talk about how digital health actually works. Keep it here on MedTalk Health Talk, only on CNN Philippines. Aside from telemedicine, healthcare providers can now extend their services through different online and digital platforms. But are these effective means of monitoring your health? Still with us is Dr. Eric Tayag, and joining us now in the program is Dr. Patrick Bugayong. He's a CPO and co-founder of Aida. Welcome to the program, Dr. Patrick.
Thank you for having me here.
Now, because of this massive development in technology, even medical consultation has changed. We can now see everything going more on the digital side of things. Could you tell us more about this? Or basically, how does a digital clinic work?
The traditional clinic is a brick and mortar type, right?
Right.
So the doctor goes there, has a few hours, and then the patient goes and visits.
Right.
Now the digital clinic puts it in the other way. So now the doctor can actually get patients through an app or through innovations in technology. So we're trying to bring back what we used to call house calls. So I realized that a sick person going to the clinic is somewhat difficult, right? So I suddenly realized that maybe the doctor can now go back to the house or go back to the patient. So our service actually allows nurses, caregivers, PTs, and doctors to provide home care without having to actually build their own practice in a hospital or a brick and mortar type clinic.
Now, Dr. Tayag, do you see any maybe disadvantages to this type of paradigm shift?
Well, in the e-health bill, there's a regulation section on telehealth and telemedicine services. Precisely because the practice of medicine requires a patient-provider relationship.
Right.
Because the concerns with telehealth and telemedicine is that you lose touch. Filipino culture is they want to be touched. If you're not touched, you have not been seen by a doctor. So we have to take care of that. Second, the inequality that I mentioned, that it will not only benefit the middle class or the rich people, it should also benefit the poor.
Now, Dr. Patrick, with what Dr. Tayag said, Opening up telemedicine and this virtual clinic, e-clinic, will just open so many doors for so many people all across the Philippines. Do you think this is a viable option in monitoring one's health?
With where medicine is going right now, it's really empowering now the patient to take care of himself, right? So if giving him access, and which is the biggest problem now that we're trying to solve with telemedicine, e-health, we want to empower the patient to actually seek help even before getting sick. So if he has access to actually medical professionals through telemedicine, or if he wants to be physically examined, he can actually go through these avenues, these new innovations that can actually help him keep his health there or even treat him when he gets sick.
So do you think these new technologies can actually bridge the gap of the healthcare that we currently see now here in the Philippines?
Yes, the biggest problem with the Philippines is because it's also our biggest blessing, right? To have 7,107 islands.
Right.
There's such a geographical challenge for medicine to actually reach the far-flung area. So technology and having a penetration rate of 50% with smartphones and other mobile apps, it can get us there. It can bridge that gap where the demand and the supply have to meet halfway. No
Right.
more is that location or that having to fly to the far-flung areas. You actually have telemedicine here.
Okay, now what are some of the biggest challenges, real quick, right now, currently, in trying to implement everything?
Okay, well, it was mentioned a while ago, infrastructure is always the problem, right? So another thing is actually changing the culture. I think Dr. Tayag mentioned that a lot of doctors, even patients, still like that old school feel, old school touch. So the culture has to change. Like everything else in technology, Philippines is like 5 years behind, where what my app is doing now is actually being done already in Thailand, in Vietnam, in China, where it's already helping people. So we have to change also the way we think and our culture. Even as doctors, we have to change. And we have to support each other in our new innovations. So I think that's the biggest problem we have to face.
Okay.
Telemedicine, the applications that Dr. Patrick just described, can be a gatekeeper. Imagine you're sick. Now you want to make a decision. Should I go to the hospital? And then you imagine the long lines. Then there's this application. And then it just says, stay home. So it saves you time. It also unburdens the hospital where there's a long queue. So the Philippines should be strategic. And the Department of Health wants to make sure that when we introduce it, because it's universal health care, we want to make sure it benefits those who need them the most.
With that, Dr. Patrick, you have a message for our viewers out there.
Medicine is growing with you. We are not a static or an old school type of science. We are gonna innovate. And there are other means of actually seeking care or getting care. So I think it's just time for us to see where the e-health bill will lead us, whether or not it brings us to new avenues. And I think we have to just keep our minds open.
Okay. And final words, Dr. Tayag.
Okay, technology can save most of our problems. And if there is hesitation on the benefits of telemedicine and telehealth, let me tell everyone this. Everything is figure-outable.
Thank you for sharing your knowledge and giving some insights on the Filipinos on this very new, and hopefully it will be able to be accepted telemedicine.
Thank you for having me.
And when we return, everything indoors as we give you easy-to-follow fitness routines while at home. MedTalk Health Talk will be right back. As you monitor your health digitally, it would be best to couple it with easy-to-follow fitness routines at the comfort of your home. And Coach Michael Olofsson, fitness coach from Snap Fitness 24/7, will help us achieve that. Welcome to the show, Coach.
Thank you for having me.
So how important is staying fit even if the person's at home?
It's always important. I mean, staying fit at home can prevent massive health issues in the future, right? So it's always better to do it now than to deal with the consequences later.
So just for the average person who wants to maintain their weight and everything, working out at home will suffice.
Absolutely.
Okay, now this latest trend we talked about earlier in the show, how telemedicine and different types of apps are there to help monitor one's health, and you can even see a doctor with certain apps. With regards to fitness, are there certain apps specifically focused for that?
Yes, there are different kind of running apps that will track how many steps or how far you run during the day. And also there's something that not a lot of people think about, but nutrition, super important.
Nutrition apps?
Yes.
Okay, oh, okay.
So there's plenty of good apps where you can just pin in what you eat, and then the app will calculate how many calories that is and how many calories you get during the day.
So we're here to focus on certain exercises that people can do at home, but can you explain to us what can someone do with these types of equipment and still be healthy?
Sure. It's all about trying to be as intense as possible in your workout where you're doing it at home. So basically, body weight works well, right?
Okay.
So just basic push-ups, and then these bottles can be used as a substitute for dumbbells.
So could you demonstrate for us? Let's give them 5 maybe exercises that they could do at home that could, like what you said, intensity is the one that's important, but can keep someone just physically fit on average.
Sure. So number 1 is, of course, the push-ups.
Okay.
But the push-up is more than just for your chest. It's just gonna engage your core, it's gonna engage your triceps and your shoulders. So what you wanna do is just get down, have your palms at around shoulder width,
Okay.
be straight in your back.
So you're looking straight forward? Is that the... Okay.
Yeah. And then just bend your elbows down as far as you can, engage your core, and push up.
Okay, that was a very good form. So on average, how many repetitions should they do?
I'd recommend a form of circuit workout. So you could do 45 seconds and then rest for 15 seconds, and then you move on to the next exercise.
Okay. Could you show us the next exercise that you would recommend?
And for that, you just need a bench or a table or a chair.
Okay.
It's called dips. Start off by just sitting down.
Okay.
Plant your hands. Step forward a little bit with your feet. And then basically, you just bend your elbows straight back and then back up.
So same thing with that, same number of repetitions as the push-ups?
Yeah, 45 seconds.
Okay.
45 seconds.
All right, so those 2 exercises, 2 down. What's the next exercise?
The next one, I thought that I'd include you, actually.
Okay, sure. Why not? Why not?
So what I want you to do is just hold these 2 bottles.
Okay.
Now we're going to do a shoulder workout, which
Okay.
is called lateral raises. You start off by holding the bottles on your side.
Okay.
Right? Chest forward,
Uh-huh.
shoulders back. Raise your arms
So I
right
just
up.
raised all the way up,
Good.
up to
About
okay.
straight level.
And then I just hold it as
Hold
long
it-
as I can?
No, hold it for maybe 2 seconds.
Okay.
Right, and then slowly down.
Okay, yeah, I feel it pretty much in my shoulders and as well as my upper back
Yeah,
as well.
Exactly.
Okay, okay. What's the next exercise? So we have 3 exercises down, 4 to go, 2 to go.
Yeah, so obviously we have to hit the legs too.
Right.
Right, so just a simple squat. I want you to raise your arm forward,
Okay.
find your balance, and then bend your knees. Right down here. Make sure that your knees don't surpass your toes.
Okay.
Right, and then back up.
Okay, so reminds me of grade school when the teacher used to punish me a lot. So your arms have to be forward. What should the person feel? What type of muscle should be engaged when they do a squat?
It's mostly going to be your legs, obviously.
Okay.
But also you have to engage your core because that's really where you're going to get enough balance and enough strength to keep on pushing for those extra 40 whatever seconds that's left in the
Okay,
round.
very good. So that's our 4th exercise. Last one.
Last one, a popular one for your core, for
Right.
your abs, yeah, and your entire body. It's going to be the plank. So this is an isometric exercise. I want you to go down to the floor. Make sure that your body is straight. And then just think of a happy place while the time flies by.
Right. Okay. So as an isometric exercise, everything that you were doing there is you were just engaging your muscles statically, maintaining that form. You weren't moving. You were just keeping that rigid form. And for how long? How many seconds should they do that?
For as long as they can. Until you start shaking and you feel like you can't keep on going, you give me 10 more seconds.
Okay. Okay. Very good. So those are 5 exercises that anyone can do at home with practically everything that they have to keep fit. Do you have a message for our viewers out there, Coach?
Just one thing. We only have one body. Respect it.
And we'd like to thank you for showing those exercises and teaching us how to keep fit. We'll see you again next time as we give you topics that help take control of your health. I'm Dr. Freddy Gomez. Thank you for watching.